Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton, and I'm a maternity pediatric chiropractor, as well as mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. This episode is sponsored by Inform Pregnancy Plus. It's a fantastic streaming platform for pregnancy and parenting. You can experience it for free at informpregnancy.tv. Today's episode is all about oral health and fertility, and my special guest is Dr. Katie Lee. Dr. Katie Lee is a dentist, educator, author, and coach. A graduate of the University of Illinois at Chicago in 2010, Dr. Lee is a key opinion leader for Noble Biocare and Ivoclar, an international speaker, and has won numerous awards, including Top 40 Under 40 Dentist in America and receiving the Woman of the Year award at the Oral Systemic Medicine Conference in Germany. She has also been featured on local NBC and Fox News stations discussing her unique practice of incorporating technologies to treat oral systemic health issues. Dr. Lee has two passions for her profession, dentistry itself and making other dentists successful. For both, she underscores the need to focus on the oral systemic health of patients. Her appreciation for the oral systemic link comes from personal experience. An ATV accident as a teenager left her without many teeth and rendered her jaw immobile. Her recovery from that incident means she personally experienced how oral health affects systemic health. That life-altering dental trauma led her to specialize her dental practice around the mouth-body connection and dental implants. She focuses on improving periodontal health by using salivary diagnostics, improving sleep health, and restoring jaw function through the utilization of CAD/CAM and implant dentistry. Dr. Lee lives in Aurora, Colorado, and when she's not working or mentoring other dentists, she loves to be in the Rocky Mountains with her husband, Dr. Doug Lee, her son Roman, and two pugs, Ricky and Jules. She and her husband enjoy snow skiing, mountain biking, hiking, and scuba diving. She also has a passion for traveling and learning about new cultures. Dr. Lee, welcome to the show. I'm very excited to have you on today.
Thanks for having me. I'm really excited about this topic.
Me too. So as somebody who's all about holistic health, meaning whole body, how all the organs, muscles, tissues are connected, that's the chiropractic philosophy that's been going on since 1895. I was so interested in learning about your book, Saved by the Mouth, Be Healthier, Save Money, and Live Longer by Improving Your Oral Health, and recognizing, the dentistry and oral connection to the systemic health of the body.
Yes. No, I appreciate that. It's been a fun journey to write the book. It's always, and I'm sure you find this in your field too, it's just kind of insane at how siloed our medical system is. And, when you only treat one specific area of the body, you end up treating symptoms, right? And you
yes.
find the root cause and people never get better. And oral health is something that's really easy to diagnose and to treat. And it's something that I think everyone should be aware of. So that's why I wrote the book.
It is so valuable. And, it is, that is the traditional medical system. And, now with functional medicine and integrative medicine happening, we're seeing how can we all work together as a team. For example, in my practice, I see a lot of infants with breastfeeding and feeding challenges in general. And I work as a part of a team with a pediatric dentist who does the laser TOTS revisions for tongue and lip ties, in as well as a lactation consultant, as well as a feeding therapist, and sometimes even a pediatric PT. So this one patient, is working with a team to, and the mom too, right? Because it's dyad. So we're supporting that dyad with a team approach because we're recognizing that we all have our expertise. And when we work together as a team, the patient gets the best results.
And that's our goal, right? As clinicians is how do we make people healthier and happier? And so that makes me so happy to hear that you're doing that. As a new mom myself, I have an 8-month-old, so I appreciate your approach.
Yeah. And, it is a team, whether it's during the pregnancy, you have your birth team, it's not just your birth provider, right? And then after giving birth, mom has a postpartum team, baby has a team, and we can all, and that's lifelong, right? Is recognizing that one type of specialty is not going to cover everything. And we all, know what we know. And I think what I find the best practitioners are the ones that say, I don't know.
And they know what they don't know.
Know what they don't admit to it, instead of saying, like, I had a woman today, oh, do I have a diastasis recti? I feel like I do. She's a nurse. She's like, my belly button is totally out and I feel my organs and something's not right. She has she's postpartum, 3 pregnancies. She goes to her primary care doctor. No, you don't have an umbilical hernia. No, you don't have a diastasis recti. It's because that practitioner doesn't know what those things are. And the reality is that dismissing and saying no is doing such a disservice to the patient, instead of saying, I don't know, that's not my area of expertise, but let me refer you to somebody who can definitively diagnose. And that's really the thing here. If we don't know, then our job is to help connect that patient with, ideally make the referral to somebody who can help them. And they're so grateful when that happens.
Well, and the other thing too is women's health issues are often under-researched, underfunded, and a lot
Dismissed.
of people don't know, and they're dismissed. So when you said that, I kind of chuckled because I was like, he was probably a man. And that's unfortunate, right? And so I love that you're doing what you're doing and I'm doing what I'm doing, because women's symptoms are a major thing, and so is fertility, right? And the whole fertility journey. And I'm just happy that there's providers out there that can give them answers to issues that they're having along the way.
Yeah, it's so important. So I do, for people who haven't read your book yet, I'd love for you to share your personal story about why you became so passionate about this oral systemic health link, and, like where that fire came from.
Sure. So there's kind of 2 real big pivotal moments in my journey. And the first one started when I was 14. I grew up in a small farm town in Illinois. I went riding on a 4-wheeler one day, and it was the only day that I did not put my helmet on. And I ended up crashing face first into a telephone pole going 35 miles an hour. How I did not break my neck or kill myself is only God knows that answer.
Guardian angel.
Angels around me, for
no
sure.
doubt.
I've been told that by several Reiki people. Everyone that works on me says I have angels. But anyway, I got off the 4-wheeler. I walked to a neighbor's house, asked them to take me to the hospital. I said, don't call an ambulance. I'm fine. Well, obviously I had a traumatic brain injury. I got shipped out to a trauma center and went into a coma, woke up about 5 days later, and I had shattered every bone in my face from my eyebrows down, and my jaw was wired shut. Now, when I crashed into the pole, I obviously had lost a bunch of teeth, and my other teeth were broken and mangled. But because my jaw was shattered, they just thought, let's wire her mouth shut right now because we got to get her jaw stabilized. And so my jaw was wired shut with all of these broken teeth. And during the next 8 weeks, I didn't know anything about nutrition. And so I survived on ice cream with Hershey syrup, pudding, Jell-O, and boxed mashed potatoes. Those were my go-to meals because that was the only thing I could eat. And I became very quickly emaciated from not getting any nutrients. On top of that, I had rampant infection in my mouth that caused systemic inflammation. My liver enzymes spiked, my kidneys started shutting down, and the doctor started freaking out of, oh my gosh, what's happening to this little girl? And so, I got my wires off, but my jaw had fused shut, unfortunately. And so it took 4 years and 9 reconstructive surgeries to rebuild my face. My final surgery was to remove my right jaw joint and replace it with my rib bone and cat cartilage so that I could finally open my mouth. It was only after that I was able to get my teeth fixed. And so I had dental disease for a long time and was also a high school girl, trying to do high school things without a smile. And the toll that it takes on you mentally and emotionally is, I can't even begin to describe what that was like. And so I learned from a very early age how much your oral health affects your physical health, your mental and emotional health. And further, because I was from such a small farm town, my family had to drive me to Chicago for care. And that was 90 minutes one way. And, I grew up in a very blue collar family. And that was, really financially hard and devastating for my family because they had to take time off of work to get me to where I needed to go. So, obviously that got me into dentistry. It got me into holistic approach to dentistry. And it also put me on this huge mission to educate as many dentists, general dentists as possible in the country, so that no matter where patients are located, they have access to great care. So in my previous 13 years, I was able to own over 84 dental practices and served as a clinical director in 5 states across the country. And I'm proud to say I was able to spread the mission of training super GPs, is what I call it. So that's how I got into dentistry. And then do you want me to talk about how I got into fertility stuff? Or?
Yeah. So I also want to hear about that. And then you're going to talk about how you help women with fertility.
Yeah. So while I'm going through, trying to build all these offices, I got married and wanted to have a kid of my own, and had lots of difficulty getting pregnant. Well, not difficulty getting pregnant, but difficulty keeping the pregnancies. And so I sought out very conventional fertility treatment, went to the best centers that I could. And it took me, I had 6 years of 6 rounds of IVF. I had 4 miscarriages. And I finally was able to have my son in May via surrogate. So we had 1 embryo left, 1 chance. We couldn't take out any more eggs. We couldn't make any more embryos. And my angels came through and gave me a baby via surrogate. But what was really interesting to me was there's so much research out there about how your oral health impacts fertility. Now, granted, I made sure my husband's oral health was okay. But what was really shocking to me was not one time did a provider ask me what my oral health was like or looked in my mouth to see if I had infection or disease. And these are supposed to be the best world-renowned fertility docs, and they're not asking questions. And I just get really frustrated when I see women come into my office that are having difficulty conceiving and they have, horrific gum infections, or they come to me with a swollen face mid-pregnancy with an abscessed tooth. And I'm like, why is none of this being taken care of ahead of time? So that's why I focus now on oral microbiome, specifically on how I can help women in their fertility journey, because it's a tough one. It's so tough.
Yeah. And I see it with the pregnant women in my practice that there is like pregnancy and hormonal fluctuations can increase dental issues with gum infection, cavities. But so I know there's that there, but what if before you get pregnant, you have this awesome, amazing oral microbiome, healthy, amazing bacteria, good dental hygiene, and all of that's managed before the pregnancy? I'm assuming that person's less likely to be impacted by those normal pregnancy hormonal fluctuations.
Yeah, absolutely. So we know that patients who have, a gum or oral microbiome dysbiosis or any kind of gum infection prior to pregnancy, they have difficulty trying to conceive. They have difficulty ovulating. They have difficulty with implantation and difficulty with keeping the pregnancy. We also know that patients with gum infection are 3 times more likely to have a preterm birth, a low birth weight baby, or a stillbirth. I mean, that's insane. And infertility is a 50-50 issue, right? It's not just caused by women, it's 50%
Right.
by men.
Correct.
And we know that those same bacteria in the mouth that cause women to be infertile also cause men to have decreased sperm count, decreased motility of their sperm, and a change in the morphology of the sperm. So both parties need to be treated.
Yes.
It's not a woman's issue, which
No.
I'm trying to get that word out there. But if we can treat them prior to getting pregnant, and this is easy stuff to do, so easy in comparison to fertility work, they can have a much safer pregnancy and healthier outcomes for a baby.
I love that. Yeah, I mean, that is a topic that has come up in Well Just a Mom in the past about the 50-50 fertility, because I do feel like even in this day and age, there's a lot more blame, shame carried by the woman in the relationship who's actively trying to conceive versus the partner. And recognizing that conception is 50% of the genetics from the sperm, 50% from the egg, and the epigenetics in our life that impact that egg and sperm before the connection are what we need to focus on. And that requires both parties to participate. So it is so important. And, I mean, even like for women feeling like, 6 years, that's gotta be also a psychologically draining, like my body is failing, I'm not good enough, like all these things that can get brought to the surface when there's these types of challenges. And, there can be challenges for some women of just never getting pregnant. And then the other challenge is all of the loss, the miscarriage, and grieving, the babies that never made it to full term. So it's real. And to your point, for all women that are looking to become moms, having both them and their partner go to any dentist, right? A general practitioner, get their teeth cleaned in a routine visit can be a game changer. Now, what if there are issues? They get their mouth checked and there's gum disease, they have bleeding gums, does their practitioner check their microbiome? Maybe yes, maybe no. Not every dentist does that, right? So talk a little bit about that.
Yeah. So back to the point of both parties getting checked, if you come in and let's say, you have some infection and I treat you, but your partner also has infection.
And then you're kissing them.
And then you go home and you kiss, you're getting reinfected again. So what people don't understand is that gum infection is an infectious disease. Mm-hmm. Periodontal disease and cavities are actually like the number one infectious disease, chronic disease in the world, which is insane. People don't take that very seriously.
And they don't think about the contagious part, right?
Contagious part, yeah. And so you're just going to get reinfected again. So we need to treat both parties for their own reproductive benefits, but also so they don't reinfect each other. And, I would say saliva testing and microbiome testing is becoming more popular, but it's still, you're going to find less than probably 10% of the dentists in the country that do this. But when you go in, the important thing is you have to test the microbiome. Just like when you go to the doctor and they do blood work, they want to see what all of your biomarkers are, right? They want to see what your blood panel shows so that they know how to treat you. It's the same thing with gum infection. If we don't know what bacteria are present, we don't know exactly how to treat, because out of the 10 or 11 super serious pathogens that can cause systemic infection, half of them are resistant to cleaning. Oh. And so at that point, now you need to go in and use other modalities of treatment, whether it be lasers, ozone, antimicrobials, things like that, to try and kill those pathogens. And the reason why that's important is there's very specific bacteria, PG and FN, for example, that we know can translocate through the gum tissue. And the first place they love to go is the female reproductive system.
Wow.
So you're not treating your gums and you're not lessening the inflammation, you're going to have leaky gums, which is the same concept as leaky gut. It's the same thing. And that bacteria goes to your uterus where it causes issues. And, the toxic metabolites of FN can cause the amniotic membranes to rupture, or can unfortunately kill the baby. So this is very, very serious. And, 40% of all pregnant women have gum infection.
Wow.
So it needs to be looked at.
I think I want to back up for a second. You just blew my mind about like somebody could have, dysbiosis, which means like too much bad bacteria, not enough good bacteria, recognizing all bacteria is not the same. We love good bacteria. We want lots and lots of it. So when we see that imbalance with this saliva testing, a cleaning alone, it may not be sufficient. Like just getting a nice, good, thorough cleansing of your teeth and gums may not still address some of those pathogenic bacteria, the bad bacteria that are creating systemic, whether it's fertility or other health issues. I know cardiovascular issues also are very much linked to some of the pathogenic oral bacteria. Hey, well-adjusted mama listeners. I'm Dr. Laura Brayton, and today I want to share an incredible resource that empowers parents in many ways, including the breastfeeding journey. It's called Informed Pregnancy Plus. This unique streaming platform provides invaluable insights and support throughout your pregnancy, birth, and beyond. When it comes to lactation, discover the remarkable collections of documentaries, including Milk Factory, The Milky Way, Breast Milk, and We're Mammals. These films offer profound perspectives on breastfeeding, challenging societal norms, and embracing the natural beauty of motherhood. From understanding the biological aspects of breastfeeding and We're Mammals to exploring cultural influences in breast milk, these films provide a comprehensive look at nursing. Informed Pregnancy Plus is an entire ecosystem of educational and empowering content for parents. Engaging web series, informative podcasts, beneficial workouts, yoga, and meditation. It's your comprehensive resource through pregnancy and parenthood. For less than the cost of coffee per month, you can gain access to the vast and growing Informed Pregnancy Plus library. Start your free trial, that's right, absolutely free trial right now at informedpregnancy.tv or download the Informed Pregnancy Plus app on Apple, Android, or Roku. Join the community of informed, empowered parents today on Informed Pregnancy Plus.
Yeah, absolutely. So there's bacteria implicated in cardiovascular disease, diabetes, pancreatic cancer, colon cancer, dementia, Alzheimer's, pneumonia, mental health, arthritis, rheumatoid arthritis, IBS. I mean, it's all over the place. And every chapter in the book talks about one of these organ systems. And there's so many more connections out there. You only have so much space in a book.
Yeah.
But this type of treatment is important for all organ systems and for overall health. But the key is you have to get tested.
Right.
If you're not tested, you may not be getting the right treatment.
So that's the problem here. So number one, we know not everybody gets their teeth cleaned on a regular basis. Maybe they only visit the dentist if they're having pain, right? Which is always the last symptom, by the way. Unless you hit a
into pain, like
pull.
You're at the end of the rope, right? Like
yeah. Assuming there's not some massive trauma that just occurred. You're living your life, la la la, and now you wake up with horrible tooth pain. That's been brewing for a very long time. And was preventable. Yeah. But they go see the dentist, and you're saying less than 10% of dentists are even checking the microbiome of the mouth. And maybe you're doing a great cleaning, and maybe that person's now going back in 6 months and doing it again. But is that enough if they're not doing some of those additional types of therapies you mentioned to clean out some of those more stubborn, resistant pathogenic bacteria?
Yeah, so there's a couple things that people can do. One is I always say anyway, people should get their teeth cleaned every 3 to 4 months, even if they're healthy. Science shows that the bacteria repopulate every 90 days. So waiting 6 months, you're doubling the time that those bacteria are there. And the longer you leave them on there, the more pathogenic that they become. The twice a year cleaning is a standard set by insurance companies.
Correct.
Not set by science. People need to understand that. So science says, bacteria repopulate every 90 days. I think people should get in every 3 or 4 months, even if they're healthy, to prevent disease. Because once you have disease, now you're in a disease management stage. You're not in a curing stage. And so it's really important to prevent that disease stage. The other thing is if people are pregnant, they absolutely need to be in every 3 months because of the hormonal changes that we were talking about.
Right.
And plus, when you're pregnant, you're craving sugar and carbs, and you're probably not eating well, and you're not feeling well, and you're throwing up. Like you're not at your best. Most women, anyway, are not at their best health or oral health during pregnancy. So they should definitely go in every 3 months. There are services, for example, I provide telehealth saliva testing for people. So I'm well aware that not everyone does saliva testing. So people can contact, other providers, not just myself, and they can do saliva testing from their own home and then work with providers to create a care plan that they can take back to their dentist to get the care that they need. And it's really inexpensive. And then, I think the big thing that people need to understand is the microbiome is a very robust, but at the same time fragile thing. And we are obsessed in America, especially after COVID, of sterilizing everything. So we use products that are, 99.9% antibacterial, will kill 99% of bacteria. Well, that's not good because those products are not selective in what they're killing.
Right.
And good bacteria are much easier to kill than bad bacteria. So
Right.
use gentler products, alcohol-free mouthwashes.
No Listerine.
No Listerine. People are like, I love the burn. And I'm like, the burn is not good. If something's burning, that's supposed to be a warning signal, right? If you touch a hot stove and your hand burns, in your brain, it's like, this is a problem.
Warning.
But for some reason, people like the burn in their mouth. I don't.
No. Because they think that's making their mouth cleaner. And that's what marketing has done a great job at teaching us that, right? There's amazing herbal mouthwashes out there. I use a probiotic mouthwash, bringing good bacteria into my mouth. So there's a lot of great alternatives. Oil pulling is another good one to help with balancing that microbiome. And the other thing is recognizing the gut tube is continuous, right? So if there's an imbalance up here, there's probably an imbalance down in that small, large intestine as well, correct?
There absolutely is. So I'm glad you brought up the gut, because what people don't realize is that the way that we got our gut microbiome is through our mouth.
Yes. Ideally, going through the birth canal and swallowing mama's vaginal flora.
Yep. So people used to think that babies were sterile in utero. And we know that that is no longer completely true, but they get introduced to a little bit of bacteria in utero. You don't want that bacteria to be PG or FN, which are the pathogenic gum bacteria, because they absolutely can get that. But the first big introduction is going through the birthing canal and taking a little bit of mom's microbiome from her vaginal canal, and also getting a little bit of her fecal material, which is great.
Yes.
And then, as babies grow, they are diversifying their gut microbiome by whatever they put in their mouth.
Yeah. Skin on skin, breastfeeding.
Yes. But what people also need to understand is that as a mom or dad, every time you're kissing your child or sucking, cleaning their pacifier, or, eating on their spoon after them, you're transferring what's in your mouth into theirs. Mm-hmm. So if your mouth is not healthy, you are now setting your child up for not having a healthy oral microbiome or gut microbiome. And so when people come to me and they say, oh, I have bad teeth or gums, it's genetic, it's in my family. Well, it's not genetic. We know that. It is in your family because
epigenetic.
Yes, it's been passed down. So even more reason to keep your mouth clean if you're having kids. Don't pass it on.
Yes. I know. I'm like talking to my husband. I'm like, honey, when's the last time you got your teeth cleaned?
Yes. So
I'm like, read this book.
Yeah. Oh, thank you.
He's so annoying. He's like, I've never had a cavity. I have Viking teeth. Yeah. I'm like, you know what? It's not about it's not only about cavities, right? Yeah. It's about, gum health and, that healthy back microbiome. And
yeah, because we get our bacteria in our gut. So we swallow about 80 trillion bacteria a day. I mean, if you just think about that, that's huge. But then we also have a secondary way that bacteria get to our gut, which is through our gum tissue. So our gum tissue is meant to be a protective barrier like our skin, like our colon and intestines. And it's supposed to keep what's in our mouth and not getting into our body. But when we have systemic inflammation or we have a dysbiosis in the mouth, the gum tissue breaks down and becomes perforated and leaky, just like leaky gut. And then the bad bacteria get in through the gum tissue and damage our systemic organs. So it's not just about the teeth. It's also about the gums.
Oh, for sure. And, even with Chinese medicine, we know different teeth have different meridians, which obviously also travel to the gum. So if there's like an infection in a certain part of the mouth, that is also correlated with a specific organ system. So, multiple ways to see that systemic connection and addressing it.
Yeah,
is so important. I had a woman in my office recently she's got a chronic infection in her jaw, and that is hard to treat. I had no idea that is something. I mean, she's been working on this for a long time, and when it flares, she's wheezing and having difficulty breathing, and it's massively impacted her overall health. Yeah. And travels to Europe looking for support, actually, because no, like it's like been so hard to access to clean it out.
And that's the thing, if you just think about Darwin, survival of the fittest, right? The longer an infection is there, the stronger it becomes and the more resistant it becomes. That's why it's so important to get at these things early, because the longer we watch and wait and see, even if someone's asymptomatic, the more superbugs form and the harder it becomes to treat down the road.
That makes so much sense. Yeah, it's not going to respond to a regular antibiotic. And yeah, I would say that makes a lot of sense. And, neglect is related to that. It's just how well do we care for ourselves? And also as parents, how are we modeling good dental hygiene? That's another big component.
For our babies. Yeah, for sure. A lot of parents don't understand that as soon as the baby teeth come in, which my son got he got 2 teeth at 5 months.
Wow.
It's time to brush.
Yes.
Little finger brushes.
Yes.
We brush every night before he goes to bed. Now, granted, he probably won't have cavities this young, but it's just important to get him used to the fact of, okay, we brush our teeth every night, and get him used to having someone in his mouth caring for his teeth versus, I'll hear parents all the time say, my 4-year-old won't let me brush his teeth. And it's
yeah, that's not okay.
Not okay.
Yeah, we have to teach those habits early. And I will also say, you hear stories of babies falling asleep with a bottle of milk or, formula in their mouth, and how that's just kind of sitting and potentially creating imbalance in that bacterial load as well, correct?
Yeah. So the milk is full of lactose, right? That's a sugar. So when they fall asleep with that bottle in their mouth, they're not swallowing that milk. So all it is it's just sitting on their teeth.
Sitting.
Yeah. And we call that, baby bottle rot. We'll have, little kids come in and all their front teeth are just black from baby bottle rot. So never, 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 never put your kid to sleep with a bottle. If they drink anything besides milk, it should just be water. They should never have juice or anything like that.
Right. Wow. Well, Katie, what else can you talk to women that are maybe having fertility challenges and what they can do to improve their oral systemic health?
Yeah, I think the biggest thing is, especially if someone's undergoing fertility work, is to make sure that they're checking underneath all of the hoods, right? And the mouth is such an easy place for people to look. And if you get a test and you have issues, you can treat the issues before you get pregnant or even during pregnancy. Again, we know that the bacteria in the mouth affect the baby 100%. They affect the health of the pregnancy, and they affect the child afterwards. There's so many studies on that. Even with gestational diabetes. So a lot of women will end up with preeclampsia or gestational diabetes. And what we know about that is there's only 10% of people that were pre-diabetic before pregnancy. And if they get gestational diabetes, they're actually at a 50% increased risk for developing full-on diabetes in 10 years after pregnancy.
Right.
And one of the main things that causes gestational diabetes is an oral microbiome dysbiosis. If you have PG or FN, that causes systemic inflammation. You get that combined with the placental hormones. They attack the pancreas, increase cortisol release, which increases our systemic blood sugar, and then we end up with diabetes. So super important just for women's health in general that they know this information and they use it to take care of themselves before pregnancy. And I also want women to know, don't be afraid to go to the dentist while you're pregnant. A lot of times I'll hear from women, oh, I'm pregnant. Don't do x-rays. Don't treat me. Don't touch me. I'm this fragile little being. And it's sure, we want to avoid x-rays at all costs if we can. Sure, we want to avoid all these chemicals and treatments and things like that. However, if we don't look under the hood and we leave a latent abscess or infection or gum infection in there, that's hurting the baby and yourself way more than if we did the necessary steps to treat you now. So don't be afraid to get treated by a dentist during pregnancy.
Right. I mean, that's what I say. Don't be afraid to go get chiropractic adjustments during pregnancy as well. First, second, third trimester, it's safe and it's really helpful. So yeah, that's a really good point. And yeah, maybe if there isn't anything emergency, then maybe the x-rays obviously can be paused But what you're saying, it's very safe and very helpful to get a cleaning during pregnancy and more frequently than maybe somebody was doing prior because of those hormonal fluctuations that are potentially impacting the increase in the pathogenic bacteria.
Absolutely. Yeah. When we increase the placental hormones, that does increase inflammation. That's why women feel swollen. They have increased blood flow also during pregnancy. And so all that means is their gums are leakier than normal. So the bacteria that are in the mouth are getting into the bloodstream at much higher rates than they were when they weren't pregnant. And so a lot of times pregnant women will come in with, bleeding gums, or sometimes they'll even have like a pregnancy tumor on their gums, which is like a swollen abscess on their gums just from all the hormones and plaque and bacteria that are there will actually form a little cyst. So yeah.
Really. That sounds painful.
Yeah. And so for pregnant women, if your gums feel swollen, if they feel itchy, if they're bleeding, that's a sign. Go get a saliva test. Contact me if you can't find one. I'll get you a saliva test and then we'll get you treated. It's very
right.
simple.
And they need to get cleaned as well.
Yes, that's part of the treatment. Yeah.
Yeah. So if women are like, hey, I want to get the saliva test done. My practitioner's not doing this and I want to know what my oral microbiome looks like. How can they get in touch with you to get that support?
Yeah. So a couple ways. One, they can DM me on Instagram. So my handle is just Katie Lee DDS. Or they could go to my website and do it there as well. My website's katieleedds.com. Shoot me a message and I will get a saliva test off to you. And then we'll do a quick virtual telehealth appointment to go over the results, talk about what your treatment options are. And then I can either find you a practitioner to treat it, or I can work with your existing one.
Yeah. And I guess there's probably a network of other practitioners all over the country and even potentially globally that you can refer to.
Absolutely.
As needed. Because you're in the Colorado area.
Yes. I'm in Denver, but there's massive integrated functional dental networks all over. And, even traditional dentists are happy to do this too. I just think a lot of it's just lack of education. But once we educate them, I really haven't had anyone push back on it.
Yeah, because it's just so logical. Is there like a website that has a list of these integrative dentists?
So there's a bunch, like another one really good resource for people to use is to go to askthedentist.com. That's not my personal website, but Dr. Mark has a really good list of everyone in the US. I'm currently working on mine, so hopefully I'll have mine soon.
Yeah, and then it'll be on the katieleedds.com.
Yeah.
That's awesome. Well, Katie, I really appreciate you taking the time to come on the show today. Do you have any last thoughts you want to share?
No, I'm just, I love the integration of all the different modalities that we can use to improve women's health. I mean, that's something I'm super passionate about, being a patient who's lived through infertility. I know that on a mass scale, that's not available to everyone. So I love that you're giving me the platform to talk about this stuff, because I think the more that we can reach out and partner, the better we can improve women's health services in the U.S.
100%. Well, thank you so much for coming on the show today.
Thanks for having me.
I hope you enjoyed today's episode with Dr. Katie Lee. She is a wealth of knowledge and information about the oral systemic link and really recognizing that our bodies are connected. And so it's very important to take care of our oral hygiene and oral health to have our overall health be optimal. And I want you to check out her book, Saved by the Mouth, Be Healthier, Save Money, and Live Longer by Improving Your Oral Health. You can get it on Amazon. It's a great resource for women who are learning how to improve their oral health, especially regarding fertility, and certainly then how hormonal changes during pregnancy and the postpartum period can impact our oral health and what we can do to mitigate those changes. You can also find out more information at her website, katieleedds.com, or find her on Instagram at katieleedds.